Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood. And our very special guest today is Leeane Terrizzi, and she's with the Brokerage Inc. And so that's kind of a little nondescript, Leeane. So tell me real quick what you do for a living.
Okay, well, basically, I have my insurance license, health insurance license, and it's with Texas and Florida.
Okay.
And I'm with the Brokerage Inc. They're basically out of Dallas, and they're an agency, and I am an independent insurance agent, and my focus is on Medicare.
Perfect, because that's good. Because today we're going to be talking about your Medicare questions
Yes.
answered. There's a lot, and I'll tell you, having to do some of this stuff with my mom was confusing, and really trying to nail down all the things because she worked way past normal retirement age. Just trying to get things it's been interesting, and so most people, it's like we understand. I think a lot of people understand Medicare, and but talk to us a little bit about you know the kind of information you need to know and why it's important.
Okay, yeah, and it really depends on what the person's situation is, what their age is when you're turning 65. And Medicare is really important. It is a federal and health insurance program. It's mainly for older adults. It's for younger people with disabilities, in certain circumstances. And the most important thing is, like, I'm going to be turning 65 in November. And yeah, and so I am
You
looking at
look
us now.
good, girl. You could
Well,
lie and
thank
get away
you.
with it.
Well, thank you very much. Well, I'm on an individual health plan, and what happens with individual health plans is that I am no longer eligible for that plan when I turn 65 and Medicare kicks in. The great thing is that there are a lot of plans out there that are $0 premium. And right now, I'm paying a pretty hefty price for my individual health plan. And that's not an employer plan. That is something entirely different, like what you were talking about.
Yeah.
And then it would be best to talk to HR, certainly, then, to find out what your options are and that kind of thing. But, it's important because, will get a very good health insurance program through Medicare. And there's a lot of preventive things. I know I've been putting off a lot of those screenings that I really don't want to do. But you know what? I'm going to do it. I'm going to get my wellness check, come November, and I'm going to just see what I need, what I don't need, and Medicare is going to take care of it.
And then so I can appreciate that. This year I decided I was just going to get everything done, and so it
Yeah.
just needs to be done. And so I think you said briefly, when you were talking about, Medicare, when I asked the earlier question about who's eligible for Medicare, and I think you kind of, addressed that. But let's do it again, just to make sure that people are very clear about when does Medicare kick in, and for those that, may end up with Medicare, how does that work?
Right. Well, the thing of it is like I'd mentioned, it's for older people who are turning 65, and it is for certain younger people with disabilities, and they need to check with Social Security on what their eligibility for that might be. Now, the thing of it is that if you're on Social Security and you're turning 65, you're automatically enrolled into Medicare. Okay, and that's for Medicare's Part A and Part B. Now, if you're not on Social Security, then you'll need to contact your Social Security office.
So I know from, unfortunately, way too much personal experience, there's all different kinds of Medicare. And so not just, A and B is your normal, for hospitalizations and then
Mhm.
doctors. And so can you tell our listeners the difference, and kind of give them some really good information about the different parts and what each part does?
Yes, and to simplify it as it like kind of like a broad overview is that Part A is hospitalization. Okay, now if you're on original Medicare, then there is a deductible for that, which I believe is $1,484 for 2024, 2021, and it does go up a little bit every year. But that does cover your hospitalization. Now, Part B is your doctors and tests. Now, there is a monthly premium for Part B. Okay, and will pay that premium. If you can opt out. If you do, then there will be a penalty or a late enrollment penalty if you don't get into Part B. And I believe that's about like 1% per month for every month that you're not into it. And Part C is basically Medicare Advantage. I mean, Medicare Advantage is Part C, which includes Part A and B, which is the hospital and doctors and tests, and then Part D, which is, or a lot of the plans, not all of them, it will include Part D, which is prescription drug coverage. And then Part D is the prescription drug coverage. And the thing that's important to know about Part D is that original Medicare does not cover prescription drugs. So if you're on original Medicare, you will need a Part D plan. If you're on a Medicare supplement or a Medigap plan, you're going to need a Part D. With Part D, then there are certain tiers for different brand or different drugs. There's different tiers 1 through 5. 1 is like the least expensive, 5 goes up to the most expensive, and there's different costs for that. And then there is a coverage gap that goes into that. And that would be like a whole other discussion on how to get into that. But it's important things to know, and that someone can talk to their Medicare, insurance rep, or call Medicare.gov and find out more information.
Well, yeah, and so you learn a lot of things, I think, sometimes the hard way. And so how does somebody choose between original Medicare, Medicare Advantage, and supplements that are out there? What are the differences in why you choose one over the other?
As you had mentioned earlier, it is very confusing. I mean, there are so many options out there, and you just really have to determine what's right for your own needs. And the thing of it is, it's not a cookie cutter thing. It's one thing that's right for one person might not be that great for another. And then like a lot of people I talk to, I talk to my friend and they've got this plan and it's good for them this way or that or they talk to their doctor. Well, the thing of it is that, it's really finding out what's important to them. And what's important to them. I always ask, what doctors are you going to? Any certain doctors that you really want to be on? I've got one that, like a cardiologist, has been going on to for years. Well, I want to make sure that person accepts my insurance. Whether it's original Medicare, Medicare Advantage, or Medicare supplement, or if they're on prescriptions, that can very much different as well. Now, original Medicare, basically, like I said, it is it's Parts A and Part B, which is the hospitalization and drug doctors and tests. Medicare Advantage, there's a lot of different plans out there, and there's a lot of good ones. And I'll tell you one thing that's really different about Medicare Advantage, or a lot of advantages to Medicare Advantage, is that they come with a lot of additional benefits, okay? Like dental, vision, hearing, transportation, fitness, and all of these come included on a lot of the plans, and which are not included in those additional benefits are not included in original Medicare or Medicare supplements. So Medicare Advantage does have a lot of those things, offerings. Now, the key too is that the person will need to be in that service area. So, that's the thing, is that, they could either go with an HMO or a PPO plan with Medicare Advantage. But the thing of it is they're going to need to be in that service area. So if they're traveling, however, or like saying going to visit a relative, and I go to visit my dad in Florida or whatever. But if I have to go to urgent care, then that will be covered. But if I want to go to a doctor there and it's just regular, I need to see a refill on my prescriptions, well, that won't be covered. That there's a lot of different good plans there. The thing is to look at what your options are, talk to a Medicare insurance rep, and it's just even to go to Medicare.gov and try to navigate everything. It's quite an undertaking. So if I would recommend an insurance rep too, so that they could, like what I do is I navigate through and do a lot of the legwork for a lot of people that I talk to, so I can bring to the table, hey, these are what your options are. And talking about prescription drug coverage too, I have like someone I had talked to, which was on a very expensive drug medication. Okay, it can differ in cost from one plan to another quite significantly. So if that is very important to that individual and that they are, concerned about the cost of that drug, then that is certainly something to look at. It's also in looking at hospitals. Hey, I want to just go to, Houston Methodist, or, St. Sheila, St. Luke's, or one of these ones. I want to be in that group. Well, let's look at the plans that are contracted with that hospital organization. Oh, and then as for Medicare supplements, the thing with Medicare supplements, there is a lot of the Medicare Advantage plans, they have a $0 premium, which is absolutely wonderful, because there's not a cost for that. You will need to still pay for Part B, which in 2021 it's 148.50, and you will need to have both Parts A and B in order to enroll into a Medicare Advantage plan. Now, when you get into a Medicare supplement plan, one thing that's nice about that is that there's the freedom of going to basically any doctor, anywhere that you want. If someone travels, or if they want that freedom, it's ideal for them. The thing of it is, there is a monthly premium. Okay, there is a monthly premium, plus there is the Part B premium. So the Medicare supplement plan could be several $100s, and then the Part B with a 148.50, it can come up to $350 or $400 a month there, in a cost per month. The thing of it is what Medicare supplements do is that they cover basically all costs that Medicare doesn't, or the majority of costs there.
So I had my first experience with Medicare probably back around 04, 03, 04. And so I had, my grandfather had retired and was staying with my grandmother, and he was paying bills one day. And I was thinking, why are your bills so high? These shouldn't be so high. And I started looking at them. And he had co-bred his health insurance for 18 months, but forgot to add her at Part B. Because 18 months, year and a half, she was declining, you forget, And so I'm on the phone with Social Security begging and pleading. It's a lot easier to beg and plead back then, just so you know. But then, then I had to learn about Part D, and I'm on the computer putting in my grandfather's prescriptions, trying to figure out which Part D do I get, and I kept thinking that if it was an ordeal for me, in my 40s, imagine what it's like for a senior to try to sit down and figure that stuff out. So I'm always thankful that I get to meet people like you. And so, so that, you can say, hey, this is what I need, this is what I have. And, so my mom just got on Part B because she just retired. And so she had to go through the whole thing about, she hit the donut hole on her medicines real fast. And so we should talk about that some other time. It's a long conversation. And so my sister took her prescriptions and called, sent them back to the doctor and said, we need to think about changing these, because now the price is astronomical, because it's not a generic that she has on 2 of her prescriptions. So you really have to work at this. And so
it is, and it's really nice to have like a liaison there, or someone there that is navigating through a lot of these different scenarios, and they can help. And there's so many questions and options out there, and just seeing what's best. And a lot of what I do is, or when I talk to someone too, it has to do with their financial cost. There are special needs plans that Medicare Advantage offers. For instance, if someone has a chronic condition, then they can go onto a chronic special needs plan. Or if they're low income, then they can also go into a plan like that as well. So, and some, like I know I have several people who I enrolled in people are in a Medicare Advantage plan who have give back on the Part B premium, which is wonderful. Like it's the 148.50 on Part B, which is essential to enroll in a Medicare Advantage plan. Well, one of these plans gave back like $95. Absolutely wonderful. The thing of it is that there's always a give and take. So if you're going to get back something on the Part B, there's something that's going to be given up within the plan. And typically it might be, that maximum amount of pocket cost, or it could be for the hospitalization and that kind of thing. So that's where it's just kind of like to see, it's really narrowing it down, looking at the big picture. Hey, these are the things that are important to me, narrowing it down and just saying, hey, and come up with a couple of different scenarios or the different plans and look and say, hey, this is what might be best for you. And then, the individual can decide that, this is absolutely what's important to me, and then kind of go in that direction.
So when does someone need to enroll in Medicare?
Well, there are different election periods. Okay. Now there's the initial enrollment period, which is, or election period, which is what I am in right now. Okay. My birth month is November. It's basically a 7-month time period, which is 3 months before the birth month. So the birth month itself, and then 3 months after that. So I'm eligible for Medicare in November 1st. So I have August, September, October in order to review and enroll in a plan, which would be effective for November 1st. I also have, if I, was just didn't think about it, put it off, whatever, I still will have December, January, and February to enroll into a Medicare plan. So that's what's really it gives a lot of leeway there into rolling into a plan at that time. The one thing that I can say is that like for Medicare supplements is that you have to qualify, or there's no underwriting when you will, if that's something that somebody wants to go through, or choose at that time. Then if they want to do it later, then they might have to qualify for underwriting. Medicare Advantage plans don't have that. The second, pardon me?
I'm sorry. And because I was thinking about, you always hear about open enrollment.
Open enrollment is every year. It's from October 15th through December 7th. And that is when a person can enroll, currently if they're in a Medicare Advantage plan, they can look at another Medicare Advantage plan. They can switch to another Medicare Advantage plan. And it depends because a lot of people's, their needs change. So, one might be in pretty good health. Like I'm in pretty good health now, so I'd look at probably the plan with the best benefits for me right now. Now, if I were to get into, have some health conditions and that kind of thing, I might want to change. So it changes from year to year. Plus the plans change from year to year. So if they're on one plan, then what their offerings might be will change from one year to the next. And, then that's why it's very important to review what they've got at that time. And then even talk to Medicare.gov or a Medicare insurance rep and just say, hey, this is the situation I'm in. How has my plan changed? And is there another one out there that might better suit my needs? And then they can change at that time.
Well, can you switch from supplement to Advantage during this time period as well?
You can't get Medicare supplements. You can get into the thing of it is that that's key is if you're not in your initial enrollment period, then you may have to qualify for underwriting, and it depends on your health condition. So if you're in pretty good health, not so much of a worry. But then it's also financial looking at it too, what the cost on that is going to be, because there will be a monthly cost for Medicare supplements versus Medicare Advantage, which might be $0 premium per month. I mean, you can do that, but that if you want to get into a Medicare supplement plan later, other than your initial enrollment or when your open enrollment period is for Medicare supplements, which is when you turn 65, then you're most likely going to have to qualify for underwriting.
Okay, that's good to know.
And then there's a special enrollment period. all throughout the year. For instance, if you move if you're on a Medicare Advantage plan and you decide, or not decide, but say if I moved from Houston to San Antonio, okay, well then my plan is not going to be in that service area. So I'm going to need to switch to another Medicare Advantage plan. Well, I can do that. It will be called my special enrollment period. All right. If I develop a chronic condition, then I could possibly get on a special needs plan for that chronic condition at that time. And it just really depends on the circumstances and what that individual is going through at that time.
All right, perfect. And so that's all good information. So Leeane, tell us how someone finds you.
You can go to my website, which is leeaneterrizzi.com. I know it's kind of like out there, but I'm also on Facebook. It's Leeane Terrizzi. It's Leeane. I think you've got it up on the screen there. All right. So I don't have to repeat that. And just, contact me and let me know what your needs are, what's kind of situation that you're in. And I'd be happy to answer any questions that I can for you and or point you in the right direction.
So the telephone number, just for our listeners, is 713-705-4136.
That's correct.
Perfect.
That's my cell phone, so it can be call or text.
Perfect. All right, Leeane, it's been a pleasure having you on the show today, and we look forward to talking to you again soon.
Thank you so much, Kim.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.